Good morning and welcome to Webinar Wednesday with Palmetto Care Connections. Today we have an introduction to school-based telehealth. Before we get started, we'd like to review just a few things. This webinar is being recorded and will be posted on Palmetto Care Connections website at www.palmettocareconnections.org. The slides will also be available to all attendees once the webinar is ended. If you have any questions, please use the Q&A box or the chat box, and we will answer all questions at the end. I'm excited to turn the webinar over now to our speakers for the hour, Crystal Williams and Savannah Brown.
Hello, everyone. I am Crystal Williams. I am the telehealth provider at Bamberg Family Practice. So let's just go ahead and get started. So what is school-based telehealth? Let's go ahead and define this clearly so we all have an understanding. School-based telehealth provides and expands a student's ability to access high-quality healthcare with the use of technology to connect the student, nurse, parent, and the provider using video technology along with other tools to complete the visit and exam. We'll go over the tools more in depth in an upcoming slide. So some of the benefits to school-based telehealth are reduced time out of class for students, reduced time away from work for parents, and elimination of time in the waiting room, which will also reduce exposure to illnesses that may be present. So essentially, school-based telehealth not only provides quality care to students, it provides this quality care in a timely manner. Just to name some of the frequent conditions that we've seen over the last year through school-based telehealth, they're listed here: allergies, asthma, cold and flu, diabetes, diarrhea, earache, infections, insect bites, mental health, pink eye, rashes, respiratory and or sinus infections, skin inflammations or rashes, sore throat, UTI, and vomiting or fever. And this may be different other places depending on how your program is set up, but we also offer ADHD visits for refills through school-based telehealth if they are a Bamberg Family Practice patient already. Other school-based telehealth visits do not have to be a current patient. Yeah. So Savannah Brown will be here to explain some of the equipment that's used, and then I will be back in.
Good morning, everyone. I was trying to make sure we're still before noon. My name is Savannah Brown. I'm the school nurse at Bamberg Area High School. I've been there for 6 years now, and I love what I do. We have evolved greatly in how we use telehealth, and we are continuing to learn and improve the process and make it smoother for students and parents and for the providers and for us nurses in the school system. We do use many tools, as you can see on the slide. The first one is an otoscope. We can look in the ears, get a live view for the nurse practitioner, the provider seeing the student, and it allows us to, again, get that live view and see what it is right then. I have another one that I brought with me that I use, and I do use this one, don't get me wrong, but I have one that I can take pictures of, and I can actually like send these ahead of time to kind of, give a little bit of a heads up if needed, or if I'm not sure that it's something that may need to be seen or not, I can get kind of an opinion beforehand without, breaking any HIPAA laws. I haven't sent, a name or anything. Hey, this is what I'm looking at. What do you think? Kind of thing. The next picture, the one on the top right, is one that we can listen at lungs and listen at the heart with. There's an app that they have downloaded, and I can record those. We can listen to them in real time, but let's say something's happening right then and there. I can go ahead and record that, and it's saved. And then that, recording, even though it may not be what's happening real time when I'm able to get on with a provider, but that recording can also be sent to, a pulmonologist or a cardiologist, wherever the student gets referred to outside of the primary care setting. And then, we have something recorded. We have something that's documented, and it's not just speculation at that point. So again, it builds that case for treating that student for the right things. We use a webcam. I have a laptop that's built in, not necessarily one that's just like this, but those comes in all shapes and sizes nowadays. But the student is able to be seen by the provider, real life. We can see color, we can see all of the good stuff, mannerisms, sound, talking to the student, hearing it out of their mouth versus just taking a report from a nurse. Granted, I'm still there, but the provider is able to directly talk with the patient. I have had parents who, and we'll kind of get into that too, but when, like parents get on, I've had parents that can FaceTime with the student off their phone. And so they can see the student, they can see the provider. But I think that's kind of on another slide. We'll get to that. So I'm gonna step back out for just a minute, and then I'll get back in whenever it's my turn to go back. Here's Crystal.
All right, so that was the tools used for school-based telehealth. So can parents join the visit? Yes, parents are encouraged to join the visit. They can join the visit through video. I can send a link, the same as a telehealth for a patient not in school-based telehealth would go. So they would see what the student is seeing and what I'm seeing. They would see both screens. And then if, for some reason, whatever the child's being seen for, they need to go home. If the parent would rather us wait until the parent is there to pick up the child, we can do the visit then, so that the parent is physically present for the visit. And then if the parent is unable to or does not wish to join the visit, I usually will call, not usually, I will always call the parent and follow up to go over meds or the treatment plan, whatever we discussed, if we need to follow up. So that's what we'll do if the parent is not present. So what provider will the student see? So this can be different based on, your telehealth program and what you have available. At Bamberg Family Practice, we have a designated telehealth provider, me, that I do all the school-based telehealth visits. But some offices may not have a full-time telehealth provider. So, they may have another provider in office that when they have time, they do the school-based telehealth, and, kind of work it into the schedule. So if you're in an office or a school looking to add school-based telehealth to your practice, this may look differently, but you'll just have to kind of go off your office's workflow and see what providers you have available. Does insurance cover school-based telehealth? So insurance companies are billed, and co-pays, deductibles do apply. Typically, Medicaid covers school-based telehealth visits, and other insurance companies, it varies, but they're typically very well covered for telehealth visits. Back over to Savannah.
Okay, so how does school-based telehealth work? The student does come to see me for whatever the issue may be. Let's go with an earache. Kind of cut and dry most of the time. So if they come in and they're complaining, my ears were hurting, a day or two, I can't hear out of it, whatever that complaint may be. And if I go to look in that ear and I'm like, this could potentially be an ear infection. I'm not allowed to diagnose, but I know what symptoms I'm looking for. I know what those things look like. That's part of the assessment. That's what I'm trained for. And so that's when I can say, okay, this is something that may need, further treatment other than just trying to wait it out. And so that's when I would, contact the parent and tell them, hey, this is what I'm seeing. This is what they're telling me. And sometimes it's, well, they didn't even tell me anything about it. I find that as the school nurse, I am the first time to hear about a lot of things as far as complaints go from kids. And sometimes that makes me feel pretty special, I guess. But so we get that, talk to the parent, hey, we've got this ability that I can get them seen by a provider today. You don't have to take off work. We can get them seen. If they need medicine, they can call it in. You just go get it. And it's one of those things they don't have to go home from school for. So it allows them to stay in class for the rest of the day. And we have the consents. Some of them already have some signs. Sometimes that's not already in place. We have moved from where they were just paper, and sometimes I'd have to have that paper filled out prior to getting this student seen. Otherwise, it wasn't an option I could offer because the consent wasn't filled out. Well, now we've moved to a digital consent, and that is, like last year, that was probably a good 30–40% of the time we didn't have that consent already done, and I was able to send a link to a parent and they could fill out the information. PCC, Bamberg Family Practice, would get that consent within 30 minutes or so. We'd schedule the visit. The kid would get seen, and I mean it was a much more streamlined process now that we have that digital consent. And that'll kind of be talked about here in just a second too on how to do that. But so sometimes the kid can get seen within the hour, depending on what it is, depending on how urgent the visit is. And Crystal and I work greatly hand in hand. Sometimes, it's like, okay, can you see us in like 15 minutes versus, okay, this can wait till about 2:30. And so again, it goes off of that nursing judgment. It goes off of how the kid is presenting. But so we'll schedule the visit, whether it's in the next 5 minutes or it's, a few hours from when I've gotten that, consent from the parent and we want to go ahead with a virtual visit. The student comes in, I have curtains that I can draw in my room to give that extra privacy to the student. I have an extra laptop, so if something else was going on in my office that I needed to finish on the computer or I needed to look something up, I have a laptop set aside just for telehealth that's been provided, and that visit doesn't have to be interrupted by anything. And so the student gets to be seen. We call the parent and get them on however they choose, whether it's by phone call, whether it's like a FaceTime call, or a Facebook Messenger video. However that parent chooses to be present in that visit. Sometimes the parent's just like, okay, well, you're just talking about medicine, talk to the kid, and we'll I can follow up based on whatever y'all decide. And so at that point, like Crystal said in an earlier slide, that she would, she's going to call that parent back. We're going to talk about that treatment plan. If the parent has any questions, they have the opportunity at multiple points, and it's not just limited to that day. Crystal is so open with, communication with these parents and making sure that these kids are taken care of, that it's a great process and that's a wonderful thing to have. But like it said, if prescription's needed, we send in that Crystal sends in the prescription for the medication. The parent can go get it at their convenience. Another thing, if testing is ordered, and I don't know if that's in another slide. It is?
No.
Okay. If testing is ordered, So let's say they come in with a sore throat. We may or may not have fever, but it could be a number of things. It could still be strep. It could be mono. It could be, COVID, flu. I mean, it could be a number of things. And so if a swab is needed to rule out some of these things, or let's say it's blood work that's needed, those orders are thrown in, the parent it doesn't have to be done right then and there. The parent, when they get off, when the kid gets home, they can run them by the office to get those labs or whatever needs to be done at their convenience. But it doesn't hold up the child from missing class unless it's, one of those things where a student has to be excluded, say they're running fever or meets another DHEC exclusion criteria where I have to send them home. But even still, if it's one of those, sometimes I can still get that student seen, the visit's done, and by the time the parent gets there, they can take them straight to the doctor's office, get the testing done, and get them home to where they're comfortable. So I'm gonna turn this back over to Crystal, and we'll get on with the show.
All right. So how do I sign my child up? So we have these wonderful QR codes now. You can, this is the QR code for Bamberg County. You will scan this, it will pull up the consent. We've been going to all of the open houses and registrations, where we also have paper copies if that's how you wish to fill it out. But this is super convenient. It's a little more easy, less time consuming to fill out through the QR code. But also, so school-based telehealth is not only for students, staff interested in telehealth. There is a separate consent for you to fill out. Just ask your school nurse where to find that consent, and we will do a staff telehealth visit through school-based. So is telehealth only for schools? No. Telehealth is for all ages and can be done, virtually at any location. You can participate from home, work, your car, wherever you may be. The only requirement is that you have a smart device with a camera that allows you to do video on it. So also through Bamberg Family Practice, we do offer telehealth for all of our patients. And this can range from acute or sick visits to checkups to any visit, basically, can be seen through telehealth. We do also offer remote patient monitoring, which we're able to monitor the patient from the home, and the provider is able to see it at the office and follow up with a telehealth call if needed. And then lactation consultation as well, we do through telehealth. The telehealth possibilities truly are endless. Davia?
Hey, I'm here. So if you are a school or a healthcare provider that's interested in providing school-based telehealth, you can contact Palmetto Care Connections. Our telephone number is listed. We also have a website where you can learn more about telehealth. We also have an annual telehealth summit that we're preparing to host on October 28th through the 30th. That's going to be at the Westin Hilton Head Resort on Hilton Head Island. So feel free to give us a call if you have any questions other than that come up after the webinar has ended. But thank you, Crystal and Savannah, for your presentation. We're going to open it up for questions to see if anyone has any additional information about how it is that you provide your school-based telehealth services. And on the next slide, Crystal, do you mind going to the next slide? Here we go. We also have our partner, the South Carolina Telehealth Alliance, listed, where you can find out additional information about telehealth there as well. So visit sctelehealth.org. And it looks like we do have some questions. The first question is, when using the QR code, where is the information sent on the back end? We have discussed using this in our school-based program for quicker consent completion if not previously completed during school registration.
Okay, yes, so the consent, after being filled out and submitted, it does have to be filled out entirely to be sent, but, Savannah gets one, so the school nurse will get one, I get one, and, the medical records, member at your office, whoever puts in your information, into the EHR, they will also get a copy. And it's sent through email, so it's immediate.
Awesome. Awesome. Does that answer your question? I believe that was from Miss Lauren Johnson. If not, let us know. Next question is, this is for Savannah. As a school nurse in a rural community, how has telehealth impacted care in the school setting?
In the school setting, it's opened up so much freedom, for a lot of reasons. I mean, previously, sometimes, like with my, kids that may need medication refills, sometimes it's hard for those parents to get them into, a provider to get seen. We've had patients switch over to Bamberg Family Practice so that process is a little bit easier. They don't have to go to the doctor, sit in a waiting room, wait for a visit, just to talk about medication refills that sometimes they've been on for years. And so that it's a quick and easy visit. The kid misses 10 minutes of class, and a lot of times with a lot of these visits, especially the least urgent ones, I will go through a student's schedule and look at their core classes. I mean, if they're in PE, biology, algebra, or something, a math, something else, I'm going to pull them out of that least complicated class, or that the class that they may not be struggling as much in. If they're in a bunch of core classes, I'm going to do whatever I can to make sure that that's easier. If they're a car pickup, sometimes I'll wait on that visit till 2:50, and they're missing the last 10 minutes of class, or a lot of times they're just packing up at the end of the day. So we're very flexible as far as that goes, to try and make it easier and more beneficial to the students, so that they're not missing class, or not missing time out of those harder core classes, versus if they're in PE and they're playing basketball, or if they're in like a non-core class. I try and pull them out of those non-core classes when I can. Again, the urgent cases, I'm going to do what's best for the student in that time period. That's my job. But it's not just limited to students. I myself have been seen through telehealth, for, various different things going on. Our staff can benefit from it. They, don't miss time from work, or hey, this is my planning period and I may not have time to get out, or hey, school ends at my duty ends at 3:20, can you get me in sometimes? And we set those things up for staff when needed. But our visit count, Crystal actually calculated our percentage rate this past year as far as telehealth visits went up 3,800%. We had 26 student visits this past year, and then 12 staff visits. So we were 38 visits total. And I think a year prior we'd had one, and a couple years prior to that we had one. So I mean, we greatly increased, I mean, in all areas, our knowledge, our expertise, our ability to offer, all of this to our students.
Efficiency.
Yeah.
That's great. And
We're
what,
much more
what do
efficient.
you, what do you believe has, helped increase those visits? Was it just once someone, a student or a staff member tried it, that they spread, the news by word of mouth? Or what was it that you think was, part of that, uh, helping to increase the number of visits, other than, there being a medical need? But what was the other, what were some other, contributing?
First and foremost, I mean, it's that we have a full-time telehealth provider. Getting that in the system was so much more efficient for us because we have that available. It's not just trying to work in between patients in the office. We have somebody that is set aside just for that. I mean, there's, been an instance where someone was seen for telehealth just based on, we were having a general conversation and she was, telling me about some pain she was having. And I'm like, you need to go to the doctor. She goes, I don't have time to go to the doctor. And I'm like, telehealth, ma'am. Like, we can get this, this does not have to be a, a huge deviation in your day. You don't have to take the time off. Like, we can get this done today. And we did. Ended up being, needing surgical intervention. We did follow up via telehealth care. And so it is word of mouth. It's, parents learning, okay, this was great. I didn't have to take time off work. And, they're like, next time, we need anything like this, call me, or you don't even have to call me, just go ahead and set it up. But I saw my parents.
Parents need to request from the nurse.
Yeah, that we need. If parents want it, if they, or, if it's something going on at home, the student may not feel comfortable, for whatever reason, coming and opening up about it. Parent can call me and I can set it up from there. The parent can call and set it up on their own and be like, hey, they've got, this class, this period, probably this is not going to be their hurting class. Can, we set up a visit for that time and then they can go into the nurse's office, get seen. You can call me later. I mean, it's, parents have a lot of involvement in this, and I mean, honestly, 100% control, because they're the ones that decide whether or not we can see their child. But getting those consents in, again, we're not going to schedule and see your child without having a conversation with you the day of. It's a lot of communication, and we make every effort that we can to, make it easier on the student, make it easier on the patient or the parent, and, getting that, like I said, that process streamlined, and we've done a lot of growth, and we've worked out a lot of kinks. And so it's a fairly easy process now, and we don't have, there's hardly any hiccups, but when we hit them, we're like, okay, how do we address this the next time? And so we're evolving, we're learning with every step. And like I said, the numbers speak for themselves, where we went from, hardly anything to, almost 40 visits in 180 days.
That's amazing. And thank you for sharing that. That, it doesn't always take off on day one, but, stick with it and you may see some change.
Absolutely.
And also some of the, I like that you, noted that there was a full-time telehealth provider added. There was word of mouth. So it seems like there's a multi-step approach to, helping increase, that utilization, but also that there's not a one size fits all. So some areas it may be a little different. But thank you for sharing that. I don't see any more questions, but I'll give everyone one more minute to add a question if you have any questions for Crystal or Savannah or Palmetto Care Connections. The last question that I have for both Crystal and Savannah is that, if from a provider perspective, Crystal, do you have anything that you would like to say about telehealth to the audience? If there's a provider on the line that is wondering if they should implement telehealth services, if they're on the fence about it. And then Savannah, as a school nurse, what would be one thing that you would have to say to a school that may be considering implementing school-based telehealth services?
I'll let you
You
go.
go
Okay.
first.
So it's funny you mentioned I had a fellow school nurse from another district message me last night asking me about telehealth. Not knowing that this webinar was happening today, not knowing that I even did telehealth in our school system. She asked me about it. Apparently they've entered into a contract with you know, a system, and she was like, how does it work? I said, well, what do you want to know? And she goes, everything. She said, we've not really implemented it just yet, but it's coming. And we do, it offers so much. Like I said, the freedom from parents not having to get off work, kids not missing school. We're able to refer out as needed, and make those connecting calls with our district here and with Palmetto Care Connections and our partnership with Bamberg Family Practice. This team that we have, I'm not as busy. I'm busy, don't get me wrong. My office stays flowing, but I don't have the caseload that, say, another school does. And so sometimes, there may be gaps where I'm not seeing a student, and there's, like at our elementary school, they don't have gaps. They're seeing kids constantly that are scheduled visits for medications or other things, and then you've got sick kids in on top of that. Whereas a high school nurse, some of that I'm able to, okay, well, you can go back to class for, and let's see how you feel in 15 minutes versus, in an elementary school or even sometimes a middle school setting, those 15 minutes, they're sitting right there with that nurse. It's not one of those, okay, go back to class and let's see how you do. And a lot of that comes with the age groups. High school, it is a lot easier for me, I do believe. However, we have the option where we have, a support system where someone from PCC can go in and, they can start with that process of getting the telehealth visit initiated, or talking to the parent and seeing if they're interested. If it's something that the nurse, has seen the kid for and is like, okay, well, this could probably benefit, but where do I find this time? Because, I've got 3 more that are walking in that are, obviously and physically sick. So, it changes day to day. And I used to work in the ER, and then the school system is not much different. I don't have the equipment. I don't have a doctor right then and there that I can just go tap on a shoulder, but I never know what's going to come through my door. I have seen, many different things walk through that door. Some of those I've never even seen in the ER. So it's based on your school system. It's based on what availability you have. If you don't have the extra hands, maybe, like I said, I know Palmetto Care Connections offers, that extra hand for us when it's needed. And so talk to your system, talk to your, your school system about that. Maybe they can, pull someone in as like, okay, well, this person can be delegated to make those phone calls while the nurse does what the nurse does. These little details can, don't necessarily have to come from the nurse, as far as, all of the paperwork side of things, I guess. So, and then Crystal.
So from a provider perspective, it's been very interesting to see that, when you think of telehealth and patients who are going to be open to telehealth, you think of a younger age or college age, maybe a little older. Most of our visits, we just pulled the numbers a few weeks ago. Most of them have been ages 50 and 60. That's our top age group aside from telehealth in the schools, and it has been beneficial on the student side because sometimes these parents can't get off in time to take them to the doctor. So if we don't do a visit, it may not get done. So parents pushing for it to the nurse, pushing for it. it really is beneficial, and it gives some of the students that access that they wouldn't have otherwise. Secondly, a provider, debating on, providing telehealth, older patients who are bedbound, them coming in for a checkup, maybe them packing their wheelchair up, or it being a huge ordeal to get them out of the house and to the office. So seeing them through telehealth, it lessens the burden on them, as well as, we're still able to get labs through home health, and have blood pressure monitoring with remote patient monitoring or whatever.
Prescriptions delivered.
Yeah, so I mean, it just,
Transportation issues.
the range from, students to elderly patients, it's life-changing for sure.
Thank you both for sharing that. We have not received any additional questions from our audience, but I want them to know that you can feel free to contact us if you do have any questions that you think of after the webinar has ended, and we will connect you with our speakers for today. So thank you all for attending our webinar Wednesday today about school-based telehealth. If you joined after our welcome, please know that this webinar is being recorded, and the recording will be posted on our website at palmettocareconnections.org. Also, please save the date for our 12th annual telehealth summit, which is October 28th through the 30th at the Westin Hilton Head Island Resort and Spa. Thank you. You all have a wonderful day. And thank you again, Crystal and Savannah, for taking time to share with us your experience with school-based telehealth. We really appreciate it.
Thank you.
Anytime. Thank you.
Thank you.